jaundice, abdominal pain, and full body rash as a presenting symptom of COVID-19. Coronavirus 19 usually can cause multiple organ damage. Usually presenting symptoms include shortness of breath, cough, nausea, and diarrhea. In some severe cases, it can cause PE and strokes. We're presenting a case of COVID-19 that presented as jaundice, rash, and abdominal pain, which is not the usual causes or symptoms of COVID-19. We have a 25-year-old who presented with right upper quadrant abdominal pain for 3 days associated with nausea and jaundice. He denied sick contact, recent travel, personal or family history of liver disease. He also denied drug use. Patient reported that he drinks 6 to 12 beers on the weekend, and he also works in HVAC where he wears a mask at all times. Upon presenting to the ED, a COVID-19 test came back positive, a YBCs, which was mildly elevated of 14, normal chest X-ray, AST of 2,525, ALT of 5,901, GGT of 438, alkaline phosphatase of 139, and total bili of 10.3 with a direct bilirubin of 7.3. He also had elevated ferritin of 6,942. Patient urine drug screen came back negative, as well as ethanol, salicylic acid, and acetaminophen, with an infectious workup that included HIV, hepatitis, HSV, VZV, ZMV, EBV, as well as RPR, West Nile, rickettsial, influenza, and more, as it's shown in the poster, all of which came back negative. We also did an autoimmune workup that included ANA, F-actin, liver and kidney microsome, anti-smooth muscle, anti-mitochondrial, which also came back negative. While in the ED, patient received N-acetylcysteine course for 3 days, as well as empiric acyclovir and doxycycline, which was later discontinued upon receiving negative lab results. On the second day, patient developed generalized body rash, as is shown in figure 1 and 2. The rash continued to improve day by day and almost completely resolved on day 5 with the help of Benadryl. Patient continued to be on room air throughout the admission. His symptoms of jaundice continued to improve throughout the admission, with a liver function test on day 17 being AST of 139, ALT of 456, total bilirubin of 3.3. As all the results of the labs came back negative, we concluded that this symptoms of jaundice, rash, and abdominal pain is secondary to COVID-19. Hepatocellular injury can be caused by multiple causes, which can include viral hepatitis, herpes species, autoimmune, drugs, alcohol. Some diseases include diabetes, NASH, vascular pathologies, as well as congenital diseases. Patient with fever, elevated liver enzyme, and rash should be ruled out for viral hepatitis. But if the patient has also COVID-19, as in our case positive, with everything else came back negative, it can be concluded that COVID-19 can cause only symptoms of hepatocellular injury, as shown without any respiratory symptoms. Thank you.